everyone, welcome back to my channel. Today I'll explain osteosarcoma, the most common type of bone cancer in young people. We'll cover the causes, symptoms, diagnosis, treatment, and prognosis. Let's begin. So what is osteosarcoma? Osteosarcoma is a cancer that starts in the bone-forming cells called osteoblasts. These cells produce abnormal bone tissue or malignant osteoid. It is the most common primary malignant bone cancer in children and teenagers. It usually develops in the metaphysis, that means the part of the bone near the ends, close to the joints, where the bone grows the fastest. Most often it's usually around the knee or near the shoulder. The peak age is during the teenage years, about 10 to 20 years old, when the bones are growing quickly. There is also a second smaller peak in older adults, often related to Paget's disease of bone or previous radiation exposure. Now let's see the causes and risk factors. The exact cause of osteosarcoma is not fully understood, but it starts with DNA mutations in the bone cells. Risk factors include rapid growth during the teenage years, genetic syndromes such as RB1 and TP53 mutations, including Li-Fraumeni syndrome, previous radiation exposure to bone, and in older adults, Paget's disease of bone. So what are the symptoms? The main symptom is persistent bone pain that doesn't go away, often worse at night or with activity. You may also see a swelling or a lump near a joint, and you may see reduced movement or a limp if the leg is affected. In some cases, the bone breaks after only a small injury, and this is called a pathological fracture. Constitutional symptoms are usually absent. Now let's see how we diagnose osteosarcoma. On X-ray, osteosarcoma often shows a sunburst appearance or a Codman's triangle, which is caused by the new bone formation lifting the periosteum. So you can see the sunburst appearance here and Codman's triangle here. MRI is used to define the tumor size and its relation to nearby muscles, nerves, and vessels. After imaging, the diagnosis is confirmed with a biopsy, which must be done by a specialist team, since the biopsy tract needs to be removed during surgery. Since osteosarcoma commonly spreads to the lungs, a CT chest is always performed. Finally, bone scans or PET scans may be used to check for spread to other bones. Now, let's see the treatment of osteosarcoma. The treatment combines chemotherapy and surgery. First, neoadjuvant chemotherapy, which means we do chemotherapy before and after surgery. It is given to shrink the tumor and to treat microscopic spread. The most common regimen is MAP, which means methotrexate, doxorubicin, and cisplatin. Next, surgery removes the tumor, and whenever possible, limb-sparing surgery is performed, where the affected bone is replaced with a prosthetic or graft. Amputation is less common today, but may still be necessary in some cases. After surgery, adjuvant chemotherapy is given to destroy any remaining cancer cells. Radiotherapy is not very effective since osteosarcoma is usually radioresistant. So what is the prognosis? The outlook for osteosarcoma depends on several factors. For localized disease, about 60 to 70% of patients survive 5 years. For metastatic patients, survival falls to about 20 to 30%. Important prognosis factors include whether there is metastasis, whether surgeons can achieve clear margins, and the response to preoperative chemotherapy. A necrosis rate of more than 90% after chemo is a favorable sign. Blood markers like ALP and LDH can also affect prognosis. To summarize, persistent bone pain in a teenager should always raise suspicion for osteosarcoma. And on X-ray, look for the classic sunburst pattern or Codman's triangle. For diagnosis, a biopsy is essential and must be done by a specialist team. Standard treatment is chemotherapy plus surgery with limb sparing whenever possible. The prognosis is best when the cancer is localized and when there is a good response to chemotherapy. Thank you so much for watching this overview of osteosarcoma. If you found it helpful, please like, share, and subscribe for more medical explainers. And let me know in the comments which topic you'd like to see next. Bye bye.